Okay, to continue, for the management of MAM or moderate acute malnutrition, um, the RUSF no, or ready to use supplementary food is usually encouraged. Okay, and after we deal with calorie and protein deficits, then we also have to treat any micronutrient deficiencies nga nag-occur. Micronutrient deficiencies are more prevalent no in marasmic children no, since marasmus is total lack of food. So meaning kulang pud siya sa mga micronutrients. So usually na anemia that is due to iron deficiency, um, and multiple B complex vitamin deficiencies. Okay? So ato po na siya i-treat. So mauna usually ang goals nato sa nutrition intervention for child with PEM. Anyways, you will have a more in-depth discussion about this uh, in your community subject. Okay, so those are types of PEM in children. What about protein energy malnutrition among adults? And these types of PEM are um, also seen no, in hospitalized patients. So this is more in the clinical setting. So the types of PEM here are cachexia and sarcopenia. So you have to be able to distinguish this na between the two. So naadiri ang differences na sa sarcopenia and cachexia. So for sarcopenia, the muscle mass no, is less than 2 st of young healthy population and decreased muscle function, while cachexia is weight loss of more than 5% in 6 months. Okay, so the etiology or the cause is also different between the two because the cause of sarcopenia is usually due to aging, while cachexia is due to an underlying disease or pathologic. Okay, so kaning cachexia is usually seen in cancer patients, in patients with HIV/AIDS, in patients with heart failure, and kidney disease. Okay, so it's associated with an underlying pathology. Whereas sarcopenia, the presence of an underlying disease is not a requirement. It's usually induced due to aging. So therefore, this is a type of PEM that is seen among elderly patients. Okay. So, comorbid condition. So, mas daghan ang comorbidities or presence of diseases for cachexia. Whereas sa sarcopenia, it could be also precipitated by an underlying disease, but again, it's not a requirement because sarcopenia can still happen. So, as noted by this negative sign, so it doesn't have um, or it doesn't need an underlying disease to occur. Okay, because iyahang main mechanism is it's caused by aging. Functional limitation. So functional limitation is limitation in their movement. This would also um, tell no about their capacity to move around, to stand and to walk. Katong mga very limited na no sa ilang functional capabilities, usually bedridden na. So mas severe ang functional limitation sa cachexia. No? Okay, but di ra kayo layo ang sarcopenia. What about inflammation? Inflammation in cachexia is very high, as evidenced by these two plus signs. No? And sarcopenia can occur no, without inflammation. Okay. uh, Fat mass is decreased in cachexia, while fat mass in sarcopenia is increased. Okay, so ang main yun nga difference ani nila duha is sarcopenia is muscle mass loss only, while cachexia is muscle mass loss plus subcutaneous fat loss. Okay, so um, you can also observe no that elderly people have more fats than muscles. Okay, so that's why mauni ang remark. Okay, so that's why sarcopenia is seen in this elderly population. Okay, maupad na ang reason no nga di na sila kayo kabako, di na kayo sila um, ligon because of this. Okay, the resting energy expenditure for sarcopenia is decreased while the okay, ang resting energy expenditure is related with the TR, di ba? So, mas mudako atong TR sa cachexia compared sa sarcopenia. Okay? Mao pod nang reason nga nung ang mga tigulang gamay na og TR. Okay? Kay tungod sa underlying muscle mass loss. Okay? And what about anorexia? Okay. Um anorexia is loss of appetite, diba? Or decreased food intake. So, mas grabe gyapon siya sa cachexia. Okay? Pero di ra kayo siya naglayo po sa sarcopenia because anorexia is also seen in sarcopenic individuals such as the elderly. Okay, di na ba na sila kayo ganahan magkaon. Okay, so mo ni ang differences between the two. Okay, so as you can also see from this figure, no, this is cachexia. Okay, um, not just muscle breakdown but also fat breakdown. So that's why taas ang breakdown pero gamay ang synthesis. So this would lead to reduced muscle mass. And fat degradation is also enhanced, okay, in cachexia. So both of these nutrients are sacrificed. Okay. Due to the underlying inflammation. Okay. So ngano na ay inflammation ang cachexia because of the presence of the disease. Okay. Inflammation also causes for these acute phase reactants to increase or decrease. Kung ang mga acute phase proteins kay ni taas, ang tawag is positive acute phase reactants such as CRP or C-reactive protein. So this is a visceral protein. So these are proteins included in the visceral compartment, okay? Because they are synthesized in the liver, okay? So the main positive acute phase reactant is CRP because mauni ang mo increase in the presence of inflammation. Whereas albumin is an example of negative acute phase reactant since its levels would decrease during inflammation. Okay? Yeah. So, mao ni nga included po siya sa atong discussion under sa proteins. This is what I would really like you to discuss on ta during your reporting. Okay, part ba yan ni siya sa unsa ni sa outline nga akong gihatag for reporting but wala kayo na emphasize. Okay? Inflammation is also affected, or inflammation also affects the brain, which will lead to lesser testosterone synthesis, which would lead to um, fatigue and immobility. Okay, and yeah, all of these factors would then contribute no to the occurrence of cachexia. So, what about sarcopenia? Sarcopenia, wala na tay labot anang um, fat loss kay fat loss is not usually seen in sarcopenia. So ang sarcopenia is just purely muscle mass loss. Okay? So na decrease protein synthesis, okay? Muscle fiber atrophy, and all of these mechanisms which would all lead to reduced muscle mass and reduce muscle strength. Okay? So um a simple tool that could help us determine know whether the patient has sarcopenia is hand grip strength. Okay, so if um, dili kaayo taas iyahang hand grip, then that might indicate sarcopenia. Okay? Because if gamay ang muscle mass, then gamay pud ang muscle strength. Okay? So, yeah. So, I hope it's clear to you, no, ang differences between two of these adult types of adult PEM. Okay? Next is biochemical response to stress. Okay, so this is being pointed out because affected man gud ang body proteins ani, both the somatic and visceral proteins. And mauni siya ang response sa body, no, immediately after the body has been exposed to some kind of stressor. So dili ni siya nga kanang conventional nga stress, nga stress ta na. Usually when the term stress is being pointed out, especially in the clinical nga mga subjects, stress means it could be due to an infection, due to an injury, or physical trauma. Okay, so mao nang pasabot sa stress. Okay, dili nga kanang ingon nato nga stress nga na stress ta. Okay, so for example, if na-injury ang tao, for example, after an accident, so mauni usually ang mahitabo. Okay? So, naadiri ang number of days, then this is the x-axis, and then the y-axis is kaning percent resting energy expenditure. So, as you can see here, unsay mahitabo 24 hours after an injury, mugamay ang REE or mugamay ang TR. Okay? Mugamay siya um, sa 80% no sa TR. So mao ni usually ang main characteristics sa ebb phase, which is the first phase to be encountered right after stress. Okay? Then as mag-progress siya, mo enter siya sa flow phase. So ang flow phase na ay early and late. Okay. So during the early phase, mo taas ang resting energy expenditure. Okay? So mauni nga time nga grabe ang catabolism or breakdown sa muscles and fats sa body. Okay? So it would start um, around 2 days, no, after an injury or after a stressor. Yeah. And kaning late flow phase, okay, so naagyapon catabolism ani, but not as great, no, as what is seen in the early flow phase, and padulong na ni siya sa convalescence or recovery, okay, if it's treated properly. Okay, so mauni ang ebb and flow phase. This is very important to know. Why? Because through understanding this, you would be able to appreciate why during the first day of treatment sa kanang injury nga nung gamay lang sa ang i-administer na nga calories. Because during the F phase, we know nga mugamay ang TR. So that's why ang atong calories nga i-administer is reduced pod. Okay? Labi na if malnourished na daan ang patient tapos na-expose siya sa stress, then mas labi nga gamay dapat nga calories atong i-administer during the first few days to prevent refeeding syndrome. Okay? So another distinguishing feature of ebb phase is that um, it's characterized by fluid deficit or hypovolemia or shock. Okay, when you say shock, it usually refers to dehydration. Okay? And again, kaning flow phase, mauning ingon nato nga catabolism. Okay. Kani makitaan po nato, no. During the ebb phase, maintenance of blood volume, catecholamines increase like epinephrine. Okay. So uh, ang goal ani, no, is to manage the fluid balance. Kay again, ang ebb phase, aside from decreased BMR, it's characterized by hypovolemia or low blood volume or dehydration. Okay? Pag abot sa flow phase, sa catabolic nga phase, no, mauning nitaas kayo pag maayo ang TR. So diri ta mag-administer og mas dako nga calories, no, given nga walay refeeding syndrome ang patient. Okay? So kani mga enzymes guys, usually they are catabolic in nature because they help break down fats and muscles to provide substrate for energy or to support the um, healing process. Okay? So, kaning anabolic, this is the late stage of the flow phase nga if the injury or if the stressor is dealt with properly, then the patient would really recover and would really enter the anabolic phase, which is now the road to recovery or convalescence. Okay. So our goal here is to actually help the patient transition to recovery or to the anabolic phase. Okay. By administering the proper care during this critical phases of the ebb and then the early flow phase. We also have the acute phase proteins, which were already discussed. No? So we have the positive acute phase proteins nga mutaas ilang levels during inflammation. So morning examples of positive acute phase proteins. Then examples of negative acute phase proteins morning mubaba in contrast, no, um, in contrast to the positive, morning mubaba during inflammation. So we have albumin, transferrin, retinol binding protein, and prealbumin. Okay. So, nganong mutaas man ang inflammation due to these cytokines that are released, no, in great amounts by the immune system. Okay. So, kaning mga IL-6, IL-1, mo ni mga cytokines that would induce inflammation and that would cause these acute phase proteins to elevate or to reduce. Okay. Na ay other effects po like neuroendocrine, metabolic, usually catabolic, no? Hematologic like leukocytosis, thrombocytosis, anemia, and changes also in micromineral status like reduced iron, reduced zinc, and high copper. Okay. So another illustration that would depict, no, the biochemical response to stress is this. Okay. So as soon as na ay open wound or as soon as na ay stressor, then these hormones that are usually catabolic would elevate like catecholamines. So an example of a catabolic catecholamine is epinephrine. We also have glucocorticoids, which is also released by the adrenal glands, and the main glucocorticoid is cortisol, which is also called the stress hormone. So that's why when the body is exposed to stressor, mutaas yun yung stress hormone or cortisol. And of course, glucagon mo taas, then mo gamay ang insulin. And ganong inana para ma-establish ang catabolic mode of metabolism sa body. That's why mag-lead siya to breakdown of amino acids para makaproduce og glucose in the process called gluconeogenesis. And maunang mag-lead siya to protein loss. Okay? So, um, why is it that we need to produce glucose from um, from amino acids from proteins? Because kinahanglan na siya for the maintenance of energy. Okay, because many tissues would need glucose as their preferred source of energy. So that's why these proteins are converted to glucose para na magamit ang kaning mga tissues like the brain, the red blood cells, the skin. Okay? So, aside from catabolism, of course, during the ebb phase, naa kaning hypovolemia or fluid deficit and electrolyte loss. Okay? So, all of these would lead to protein loss and increased TR. Okay? So, you have to understand this. And I think mas masabtan pang specifics ani no when we discuss no the final term. Okay. Next is the dietary lipids. Okay. Um,